My name is Dr. Turner. I am presently living in and not only a resident but a citizen of Canada, but I was born in the United States, so I have dual citizenship.
How would you rate Canada's medical system on a 10-point scale, 10 being the highest and 1 being the lowest, and why?
I would rate it probably around, I would say an 8. We have excellent care here in Canada. Any of the situations that I or my family has been involved in, we've got immediate care. Part of that I can attribute to the family doctor that I have, which I consider very good, and the local hospitals we have in our area. I have friends that have not necessarily had the same experience, which is why I don't give it a 10 out of a 10. There have been friends and family that have had wait times that I haven't had to deal with, so I do know, not personally, my wait times have been pretty low. At second and third opinions, if we requested it, all in all, we were not kept in the dark. We were told exactly what we needed to know, and if we had questions, we would either get them answered then, or if we came up with more questions and contacted the healthcare professionals, they gave us the information we needed.
To your home country, which of the two do you think is better?
I think it depends upon where you are. I'm from the States originally, and I was there as a teenager, a young child and a teenager, so I never really had any health issues per se. I have family though that is there, and they have had some severe health issues. The care that they got was excellent. However, it's kind of a two-tiered system there compared to here. In Ontario, everyone has OHIP, so everyone has a certain amount of basic coverage. Any excess coverage or other coverage you might have would be through your workplace if you have insurance through the workplace, or if you have private insurance. In the States, it's different. There's Medicaid and Medicare, and we have some similar things here. If you're over 65, you have lots of coverage automatically through your Social Security, like we do through our OHIP. But if you're not 65, if you're not a retired person, you don't automatically get coverage from the government. You only get coverage if you're a very low income person. So if you're in a mid-range income, you're without coverage and you have to pay for everything. And if you can't afford to pay for certain services and you go to the hospital, they just don't do them for you. It's not like they do them and ask you to get paid. In some cases, you may not even be allowed to get past the emergency room. So it really does depend. But the care that they give, when they give care, is excellent. I spent a number of days an emergency room nurse would in the States. So yes, we don't have enough doctors, we don't have enough nurses. They are leaving to go elsewhere, and a lot of it has to do with where they can get hired. I mean, here, the hospitals need the doctors, they'd love to hire them, they don't have the funding to do so.
Why do you think doctors who train in Canada leave to fulfill their career in the United States or elsewhere?
Again, a lot of it, as I just said, was money. But there's more than that too. We have hospitals, we have some hospitals, we're lucky to have MAC right here. There are some hospitals that are involved in a lot of research, and some doctors want to treat patients, others want to treat patients and do clinical research.
Do you think that our healthcare system is falling behind compared to other countries?
Yes, and I think the reason being, and it's all related to lack of funding, so lack of people available to do the care, lack of nurses. They're constantly cutting back. Whenever we see government cutbacks in healthcare, it's always frontline. The nurses are cut, and then the doctors. And you hear a lot of times about beds not being available, people that have gone to the emergency room and they're sitting in a hallway on a bed. A person that way, they have to be in attendance by a nurse or a doctor or some healthcare professional. So yes, I believe that we are starting to fall behind. Our technology and our knowledge is good, but it's being able to actually put that into practice